Chief Minister Uddhav Thackeray on Friday refuted rumours that the army would be called out in Mumbai as COVID-19 cases showed no signs of abating and said if required, the state may seek additional forces from the centre to afford rest to the stretched state police force in a phased manner. He said there is a rumour that Mumbai will be handed over to the army and everything will be locked down and all shops will be shut. There is no need for the army and the army will not come to Mumbai. The soldiers are keeping the borders safe and in this fight against coronavirus, we are the warriors. He added that the state machinery including doctors, administrators as well as the police is overworked and under a lot of stress. He said the police need to be rested in phase-wise manner. Until that time, if required, manpower will be asked from the central government. As the number of COVID-19 infections in India nears the 60,000 mark, the centre on Saturday revised its policy on the discharge of COVID-19 patients and most crucially said that only severe cases will now be tested, that too only once before being discharged. Until now, patients were discharged only if 2 of their specimen tested negative for COVID-19 in RT-PCR swab test after a gap of 24 hours. The changed guidelines for hospitalization come into effect as India is bracing for a spike in the number of infections, with mathematical modelling predicting that the peak could be in June-July. The Ministry of Health and Family Welfare in its revised guidelines said that mild or very mild pre-symptomatic cases admitted to COVID-19 care facility will undergo regular temperature and pulse oximetry monitoring. Some residents frustrated over a strict coronavirus lockdown in Gujarat's Ahmedabad hurled stones and were met with tear gas in clashes with paramilitary forces on Friday. Authorities in the city ordered all shops except those selling milk and medicine to close on midnight Wednesday until May 15th, implementing a stricter lockdown than the national one in place since March 25 in an effort to curb rise in infections. Clashes erupted in Shahpur locality of Ahmedabad when police and paramilitary forces tried to enforce the lockdown, asking people to stay indoors. However, police also fired tear gas to dispel the crowd of protesters. With Gujarat reporting a large number of COVID-19 cases and fatalities, medical experts from AIIMS, including its director Dr. Randeep Guleria, have rushed to Ahmedabad to provide expert guidance to doctors there on COVID-19 management. Following directions from the central government, Dr. Guleria, who is pulmonologist, and Dr. Manish Soneja from the AIIMS Department of Medicine left for Ahmedabad on a special Indian Air Force flight on Friday evening. They will visit the Ahmedabad Civil Hospital and SVP Hospital on Saturday to provide expert guidance and advice to the doctors on treatment for coronavirus patients there. India's tally of coronavirus disease stood at 59,662 after 3,320 new cases and 95 deaths were reported in the last 24 hours. The total tally now includes 39,834 active cases, 17,846 people who have been cured, discharged, and 1 migrated case.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.